In 1996, I started dating my future wife, Winnie. And well, this was after a period of friendship of 3 years. So in 1996, it sort of got more serious. And I proposed to her and I asked her to marry me. Now, in 1997, she went out of the country on a short term trip to England, where she was ministering to churches there. So I was left in the country and I started working in a finance company. So she came back in 1998 and we sort of continued the plans to get married. Uh, she was not initially working. So she started volunteering with this organization called Community Health Evangelism that was based in an Assemblies of God compound in Nairobi. And we continued with the process of dating. We got married in 2000. During that time, of course, I wasn't very sure what community health evangelism was all about. It actually sounded like some funny organization. Community health evangelism? What's all this about? So I wanted to tell my wife to go ahead and get a job and to stop, for lack of a better word, wasting her life. But she tried to talk to me about community health evangelism. I tried to listen to her, but I still could not make head or tail of it. One of the things that we had done in our earlier life at the university is that we had committed ourselves to be involved in mission work. So during that time, I started feeling a tug at my heart that there was a need to actually get involved in mission work, not later in life, but as soon as possible. So during that time, I left my place of work. This was in the year 2003. I went back to school and did a master's program for a period of 3 years. During the master's program time, I got more and more involved with this program called Community Health Evangelism, and it's actually started making head and tail. I started seeing lives of people being transformed physically and spiritually. I started seeing drunkards stopping to drink and open their businesses in some of the slum areas of Nairobi. I started seeing some of the people who are begging on the streets of Nairobi stopping to do that and start their own businesses. Children being taken care of by their parents, responsible adults who are actually willing to take care of their neighbors' needs. I saw churches being planted through the community health evangelism program. And so I actually started seeing it as a possible vehicle to use in ministry. So while still doing the master's program, I attended a vision seminar of community health evangelism. More and more interest just seemed to grow in me about the program. So in 2004, in the year 2004, I and Winnie decided to apply for the Medical Ambassadors internship program for community health evangelism that is held in the Philippines. During that time, that was the only place that you could go for an internship program. So we got accepted, and in July 2004, we went to the Philippines for the program, and we spent a period of 7 weeks seeing the program, learning new things to do, interacting with people from other countries, hearing what they were doing through community health evangelism. And it was actually now much, much more of an eye-opener. And we actually realized that this is a program that works. We had seen our bit of it working, but we now noted that it could actually work around the world. When we got back to Kenya in 2005, we were appointed to head Kenya. No. In 2006, we were appointed to head the programs in Kenya. During the same year, I also finished my master's program. My plan was to continue with my education and to also start lecturing on medical microbiology. But somehow God confused that plan and removed it out of me. And I found myself being more and more involved with community health evangelism. So this kept on growing up until 2009, when medical ambassadors called on us and requested us to take over the leadership of community health evangelism programs around East Africa, which covers 9 countries. So currently, we have been in this position for the last 4 years or so, and we have seen a lot of growth. We've seen a lot of ministry in Christian and non-Christian areas. We have been able to see setup of business. We've been able to see issues of women's ministry growing. We've also been able to see, through the grace of God, even aspects of disability being addressed, and growth of programs across that whole area. So what I can say is that this is an effective program, and what we have been able to achieve has been, first of all, through prayer, commitment, support by medical ambassadors, international and also other organizations, and also a very capable and committed staff who are able to actually sacrifice their lives to see the lives of others being changed.
Yeah, I had this very good friend of mine who was passionate about missions. She was also my mentor, so she kept following me up and wanting me to be involved in ministry. So she got me involved in student ministry after herself, and she got involved in overseas mission, which she introduced me to, which I did. And after that, I came back to Kenya, and I found she was involved in another ministry where she was doing trainings for communities and helping communities to, do things for themselves. And it was a very interesting ministry to me, especially because of my social work background, and always want to work with people and help them, make better of their lives. So it was something that was really interesting for me. And so because at that point I wasn't working, I was just doing interviews for work, I asked her if I could volunteer in the office and help her do a few things. And because she was just her and the director, they were quite busy. So sometimes they'll be going even to other countries to do training, and I'll be left in the office. I'll be answering their emails, I'll be tidying up, cleaning the office, doing filing. Until one time when they were having an in-country training, and I participated in that. And that was my first introduction to community health evangelism. Of course, after the training, I had an opportunity to now visit communities and just be able to see what the training is doing in the field. And I could see the people who've been training, some of the things that they are doing for themselves that they never used to do before. They could grow their own vegetables in a pot, which was, a very amazing thing, because they would say we don't have any land to grow vegetables. But there was this opportunity to just grow your vegetables in a small pot, and you have enough for the family for a week. So that was very interesting to me. So I kind of got hooked to that, and I continued doing training. So when they needed staff, I was right there doing volunteer work, and they just got me on board. So I started doing trainings as well. I've since then been married. My husband is also involved, and we started with directing the ministry in Kenya, and now we are directing the ministry in East Africa.